You nick your thumb while slicing an apple. The kitchen is warm, clean water rushes from the tap, and a paper towel turns pink beneath your hand. You rinse the cut, press on a sterile bandage, and go back to breakfast. If the skin swells tomorrow, you have antiseptic, antibiotics, a clinic, and a century of tested science waiting behind a glass door. Now tear all of that away. No clean tap, no pharmacy, no germ theory. No doctor who understands why a wound smaller than your fingernail can fill with pus, poison your blood, and kill you before the next moon. So the question is simple. For hundreds of thousands of years, with no vaccines, no antibiotics, and no hospitals, how did your ancestors survive sickness, childbirth, shattered bones, and infected wounds at all? The first answer is not a miracle plant. It is another person. Picture yourself with a broken ankle in a hunter-gatherer camp, where every meal requires movement and every mile separates you from food or water. You cannot follow the herd. You cannot outrun a cat. You cannot carry water, gather roots, or even move safely when the weather turns. Alone, you are finished. But your ancestors lived in groups, and that changes the medical equation completely. In Shanidar Cave, in the mountains of Iraqi Kurdistan, archaeologists found the remains of a Neanderthal, now called Shanidar I. He lived roughly 35 to 45 years, despite a crushing injury near one eye, severe hearing loss, a badly damaged right arm that was partly missing, and injuries that likely left him walking with pain. Every major injury had healed. His survival is difficult to explain unless other people fed him, protected him, slowed their movement, or gave him work he could still perform. Think about that for a second. Long before anyone could name bacteria, your ancestors already understood the most important rule of emergency medicine. Keep the injured person alive long enough for the body to repair itself. Someone brought water. Someone chewed food. Someone stayed awake through the dark because survival depended on care continuing after everyone else had gone to sleep. Before medicine was a substance, it was a person, but even the most devoted person could only buy time. A wound still burned, a tooth still throbbed, and fever still climbed until the night air felt like ice and your own skin felt like fire. This is where your ancestors began turning landscapes into memory. Here's the part nobody talks about. Plant medicine probably did not begin with a genius discovering a cure in one dramatic afternoon. It grew from thousands of small observations, repeated across generations, beside rivers, forests, caves, and campfires. This leaf numbs your tongue. That bark eases pain. This resin seals a cut. That mushroom makes everything worse. The people who remembered survived more often, and the people who taught others turned private luck into shared knowledge. At El Cedron Cave in northern Spain, researchers examined hardened dental plaque from Neanderthals who lived about 48,000 years ago. One individual had a painful dental abscess and signs of a chronic gut infection. Trapped in the plaque were traces consistent with poplar and penicillium mold. Poplar contains salicylic acid, the natural chemical family that later led to aspirin, while some penicillium species produce antibiotic compounds. That does not prove this. Neanderthal invented aspirin and penicillin. It does suggest that a sick individual was consuming unusual materials with possible medicinal effects. Thousands of years later, the same process became writing. The Edwin Smith Papyrus, copied in Egypt around 1600 BCE from older material, describes 48 cases of injuries and wounds. It recommends examining the patient, deciding whether a condition can be treated, closing some wounds with stitches, and using linen dressings. Egyptian medical texts also describe honey on wounds. Honey is not magic, but its concentrated sugar pulls water away from many microbes, making life harder for them. Your ancestors did not understand molecules, they understood results. The forest was not a pharmacy. It was a library, and survival depended on remembering how to read it. Then came the injuries no tea could fix: a fall from a cliff, a boar's tusk, a stone blade slipping across the hand. A crushed limb could bleed, rot, or trap you in one place until hunger finished the job. The obvious answer is that ancient peoples simply died from injuries like these. Sometimes they did. But in 2020, archaeologists excavating Liang Tebo Cave in Indonesian Borneo uncovered a young adult buried at least 31,000 years ago. The lower third of the person's left leg had been deliberately removed. Probably during childhood, the cup bone had completely remodeled, which means the patient survived for another 6 to 9 years. There was no clear skeletal evidence of infection at the amputation site. Here is what does not make sense until you think about it. Cutting off a leg is only the first minute of an operation. The real achievement is everything afterward. Controlling blood loss, avoiding the wrong vessels, protecting exposed tissue, carrying the patient, feeding them, cleaning the wound, and repeating that care for weeks. Whatever tools they used, this was not a lucky accident. It was a medical system without a building, and ancient surgery kept improving. In Peru, researchers studied more than 800 skulls with openings made by trepanation, a procedure in which part of the skull was scraped or cut away. In the earliest group, dating from roughly 400 to 200 BCE, about 40% showed long-term survival. In samples from 1000 to 1400 CE, survival reached as high as 91%. Based on healing around the bone, smaller, shallower openings and better technique appear to have made the operation safer. Over time, they had no electric lights, no monitors, no sterile steam. They had experience, nerve, and no room for error. But the most dangerous medical event was often not a hunt or a battle. It was birth. You enter a modern delivery room surrounded by washed hands, bright lamps, measured heartbeats, pain control, blood for transfusion, and a surgical team minutes away. Your ancestors entered labor with none of that. Human babies have large heads, and the path through the pelvis forces the baby to turn during birth. When something went wrong, there was no emergency cesarean section waiting nearby. So how did mothers survive? Often, they did not. The truth matters, but when they did, they rarely faced labor alone. Experienced women could recognize position, support a squatting mother, apply pressure, receive the baby, clear the mouth, cut the cord, control warmth, and notice bleeding before the mother herself understood the danger. Skill lived in hands before it lived in books. Anthropologists Karen Rosenberg and Wenda Trevathan have argued that the unusual twisting path of human birth made assistance especially valuable deep in the human story. You were safer with help. By 1750 to 1700 BCE, that help appears on a painted birth brick from South Abydos, Egypt. The evidence is made of mud. The 36-centimeter brick shows a mother and newborn supported by attendants and was probably connected to squatting during delivery. Its images invoked divine protection, but the object also reflects something practical: posture, support, and other people in the room. Magic and medicine were not cleanly separated. A chant could calm breathing. A ritual could force everyone to slow down, bring food, keep watch, and treat the mother as someone under special protection. The belief might be wrong, while the care around it still helped. A safe birth was never one woman's victory alone. Now comes the uncomfortable answer hiding beneath every story of ancient healing. Your ancestors survived before modern medicine because many of them did not survive at all. Golden age of naturally perfect health. Infants died. Teeth became infected. Diarrhea could empty a body faster than a family could replace the water, while a deep cut could end a life before anyone understood why. And as your ancestors built permanent settlements, some dangers grew worse. At Çatalhöyük, in what is now Turkey, between about 7,100 and 5,950 BCE, thousands of people lived in tightly packed mud brick homes. At its peak, the settlement may have held 3,500 to 8,000 people. Researchers found evidence of crowding, infectious disease, violence, nearby animal pens, waste, and traces of human and animal fecal material inside domestic spaces. Farming supported denser populations, but it also placed humans, animals, trash, and pathogens close together. Before large settlements, a fast-moving infection could burn through a small band and run out of new hosts. After farming, disease found crowded neighborhoods, stored food, standing waste, and a constant supply of children who had never encountered it. Progress fed more mouths. It also gave microbes more doors. So the real answer is less romantic than a secret ancient cure. Your ancestors survived through layers of protection, each one imperfect. Your body, clotted blood, raised fever, built new bone, and attacked invading microbes. Your group added water, warmth, calories, splints, herbs, wound cleaning, skilled hands, and time. Then memory carried successful methods forward, while failure quietly disappeared with the dead. Here is the deepest reframe. Medicine does not usually heal you by itself. It helps your body survive long enough to do the healing. Modern medicine does that with astonishing precision. But the basic mission is ancient. Stop the bleeding, reduce the danger, support the body, and do not abandon the patient. Winter came at your ancestors with hunger, infection, injury, and exposure. They answered with fire, food sharing, plant knowledge, and shelter. Trauma came with broken bones and torn flesh. They answered with splints, dressings, surgery, and weeks of care. Childbirth came with pain, bleeding, and terrible uncertainty. They answered with posture, practiced hands, ritual, and women who remembered what the last birth had taught them. And even then, death often won. That is what makes their survival remarkable. Your ancestors were not invincible, and they were not ignorant animals stumbling from one lucky remedy to another. They watched closely. They experimented carefully. They remembered failure. Most of all, they reorganized their lives around people who could not survive alone. Now return to your kitchen. Warm water runs over your thumb. The wrapper crackles. The clean white bandage presses against your skin. And somewhere behind that tiny object stand Neanderthal, caregivers, forest experimenters, Egyptian wound dressers, Bornean surgeons, Andean skull specialists, midwives, mothers, and countless unnamed people who learned one useful thing and refused to let it die with them. Every time you cover a cut, you are holding 300,000 years of people refusing to leave one another behind.